Okay, good afternoon, good evening, all. Pardon the delay, we're still having some technical glitches. I promise you I was here at 4:30. But we'll get right into the gist of the information I want to bring across to everybody. Primarily, issues around testing and airport vaccines and medications. In terms of what's happening with the numbers that we keep getting, I know that we, to a certain extent, are being told that some people are a little bit complacent in terms of letting their guards down. So when we went back to review, we're reviewing the data as you would know on a daily basis. I can tell you that we did have lower positivity rates based on samples taken in the second week of September. Not as high numbers as we had in August, but the numbers were still in the first week of September significant. They were in the third week of September. They kind of went back to where we were in the first week of September, and the last week we had noticed, particularly for Corozal and Ridgewalk, that they still have increasing numbers. The 21st of September was when we had the least amount of percentage-wise, that is, we had 4% only of positive samples that were processed, but we are going routinely now between 15 to 18% of the samples that are processed are turning out positive. The preliminary data for today would indicate that we have at least 37 new cases. I don't have the breakdown of that as yet, but that's the preliminary data. It could very well be a higher number that we are having. You would also have been made aware that we had indicated that we were going to be doing rapid testing, and rapid test process, the SD biosensor, was used in August Pine Ridge last week, Wednesday. And that same day is when we were actually doing the validation of a third rapid test. That validation process has not been completed. It should be completed later on today or tomorrow. So once we have completed that validation process, we can release the results of those rapid tests that we have. Understand that once the rapid test becomes part of a routine processing of samples for a specific population, we will be using a separate platform because the infographic is updated in real time from information gathered from the lab. And you would note that rapid testing is going to be field work for the most part, so that you, in point of fact, are not going to necessarily be receiving those results in real time. The rapid tests were also used on the first flight of two flights that arrived on Friday. The 20 plus passengers that arrived, all of them were negative upon arrival. The second flight that brought in repatriated Belizeans, which is one of the smaller groups that has arrived, brought in those persons didn't go through a rapid test. They went through a PCR test, and those results should be out so that they would be able to leave and go finish the quarantine at home. Just before I get into the other parts of that, in terms of vaccine, the flu vaccine has already arrived for this new flu season that's starting to come. So you're gonna find information being provided in different platforms throughout the week as to which populations will have first access to the vaccine. But we also want to be able to give you the total number we received and the cost that it has, so that we can appreciate what is going into those elements of prevention. Belize has also submitted a letter to the COVAX facility, which is the overarching body that is trying to oversee the equitable distribution of vaccines for all countries, especially countries such as Belize, that's small in population and doesn't compete economically as other bigger countries do. But what it aims to do is ensure that everybody has vaccines in real time. We can also note that every country is being told that in the first instance, you more than likely are only going to be having vaccines for 20 to 30% of your population. So every country will have to make determinations as to which 20-30% of the population will have access, initial first access. Similar with the flu vaccine, we don't necessarily bring vaccines for everybody. We'll see what the uptake is this year, because in previous years when we have brought, it hasn't all been used. That's with the flu vaccine. You would have heard in a different forum, which we kicked off a Wellness Week platform earlier, particularly topics related to overall wellness, to mental health, to nutritional component, and to physical activity. All of those are key components in terms of the prevention of non-communicable diseases. It's also important for SARS-CoV-2, because for the Belize context, what we are noticing is that there seem to be two salient risk factors that are starting to come out in people who are having mortality associated to SARS-CoV-2. And those two risk factors, in almost all cases, would be hypertension, high blood pressure, and obesity. So it's important that we address those situations, because once you start addressing adequate health, eating adequate or healthful, drinking healthy drinks, doing physical activity, you're really counteracting the diabetes, the hypertension, the obesity, and obviously the SARS-CoV-2 element. So those are being discussed throughout this week. I know we have other forums where we'll be talking about nutritional components. There's, I think, a yoga session that's going to go virtual. So throughout the week, you should be having further topics of discussion related to a healthy lifestyle, and we're trying to peg that to COVID-19. As is, I'm being reminded tomorrow is World Heart Day. Trying to promote a healthy lifestyle in terms of preventing and having heart situations, or a healthy heart, if you will. Today is also World Rabies Day. We can't go away from that. Today is actually the anniversary of the death of Louis Pasteur, who is, as you would know, one of the primary persons behind vaccines and all the history we have behind that. So on the anniversary of that is when World Rabies Day is observed, the anniversary of his death. And it is simply a day set aside to raise public awareness about rabies prevention. In some countries, it is listed as a neglected tropical disease because we routinely don't talk about it. We routinely don't worry about vaccination unless there's a specific incident where people may have been exposed, but it still happens. Pasteur, as I had mentioned, was the one who developed the first rabies vaccine, which is routinely now used in different forms across the world. So those two elements needed to be highlighted. One more thing that we will be stressing before the airport opens on Thursday is what do people need to know, especially people that are arriving, and especially for relatives receiving anybody who's coming from the US. So as we know now, the tourists would still be only accessing gold standard hotels, which means that they are not going to be able to go into the general stream of just coming and going. Belizeans, and I need to stress this, even though you're not going to be required to quarantine in a hotel upon arrival, it is still going to be the staff at the airport that will be telling everybody that you must or you should go and do at minimum 7 to 10 days of quarantine at home. And the reason is very simple. Even if you're bringing a negative PCR test, you may have still been exposed en route to coming to Belize. So I think people here can appreciate that you can bring a potential exposure from whoever is visiting you, and the people who are coming here to visit can also appreciate the reason why we are suggesting that you do elements of self-quarantine at home, because at the end of the day, we want to make sure that you're avoiding exposure with your community, with your family, with your friends. So that will be the recommendation and blanket recommendation we're making for everybody. I think we need to stress this because it's a common question that's coming to our hotlines. I know that the BTB website and the infographic is being updated in a dynamic kind of way. We are also strongly recommending, you may not find it necessarily in the infographic, that all Belizeans returning, if they can bring back a PCR test, the closer you can have that to when you board your plane, the better it is going to be for you, and that will allow for a quicker processing of your situation at the airport. Similarly, for tourists, if they're bringing a PCR, a PCR test, then that will expedite the process at the airport. Even if people do bring PCR tests, though, understand that the quarantine officers at the airport may still be calling upon you for a random PCR, and that's just part of their routine processing mechanism that will be at the airport as of Thursday. I need to also stress that there is the health app has now been modified, and it's been circulated from the last version towards the end of last week. You do need to download the app, because that app is what will expedite your process at the airport once you arrive. If you don't have the health app upon arrival, then you will have to be delayed a little bit in your paperwork being processed, because then you're going to be asked to fill in all the paper forms as you walk through the different processes at the airport. Understand that now upon arrival, if you have traveled before, you know how you get through. When you arrive, you basically just walk over to immigration, and then go on to luggage, and then you go on to customs. So you will have a little bit two different processes at least that you will be made aware of. One is people from the tourism sector trying to channel you to the lines that will be set out specifically for persons. People checking whether you have the health app or not, because if you have the health app, the Ministry of Health personnel will already have access to your data, and that expedites the process of getting you swabbed and results processed rather quickly. If you do not have the health app and have to download it there or fill in the form, then that will be a delay in terms of walking you through the health swabbing booths and getting your results. So having the health app will expedite the process significantly for you. So it is a recommendation that everybody coming should be downloading the health app and filling in the information within 72 hours before you travel. That will make everybody's job easier. As we walk through, I believe that on Wednesday there will be a walkthrough with the media, as I understand it, of how the flow will be through the airport. But tomorrow we should be having further notes to walk you through the process. But I think if you are listening here in Belize and are able to communicate to your family members who start arriving as of Thursday, there is no quarantine in a hotel, but the recommendation for quarantining your relatives at home, notwithstanding they bring a negative PCR, notwithstanding they may get a rapid test that's negative, is simply just because you want to make sure you have not missed anybody through that window period that can happen, because you know that you can start developing signs and symptoms after exposure up to, on average, 7 days after your last exposure. So assume you went through airports and different planes before landing here. So you bring your PCR result, which is negative, but your exposure happened on the plane or somewhere before you got here, then that's the reason, and that's a protection element we want to be able to have for everybody. So that's what I basically wanted to address. I think we'll have some quick questions to go through, and then before I forget, also people who are leaving, we need to stress this again, because it seems everybody that's leaving now is asking a PCR test be done on them. The PCR test that we are doing, we are routinely doing it on Thursdays for people that are leaving. So if you are out of Belize City, it does not mean you're in Belize City. You will have to get swabbed either Monday, Tuesday, Wednesday, depending on your local public health facility. That sample needs to get to Belize City Thursday morning, process the same day, and then we give out the results Thursday evening, early Friday morning. Belizeans who are requiring a PCR test, who are traveling for essential reasons, should submit copies of, if they are a student, of their school that they are going to and where they are going to, of course. Belizeans who require medical services outside of Belize should also be able to submit that, so that we can consider those. We are not routinely doing PCR testing on Belizeans that are leaving for other reasons, nor do we do it on the spur of the moment. And I'm saying this because we just got an email from somebody who's saying that they leave tomorrow for Honduras, so they want an expedited test because it must be 72 hours before you go. It cannot work like that. It does not work like that. This is, I think, the third or fourth time we have explained under which conditions we are doing it, and we are trying to accommodate everybody, but it is not as easy as people are assuming, I guess it is. We are getting also requests from foreigners who are going back. Those will be considered on a one-on-one basis, but again, we are not routinely doing that. Belizeans returning are not also getting routine tests being done from where they leave. So we will consider those only on an individual basis for foreigners that are leaving Belize, and again, it will have to be for an essential reason. I'm a property owner and will be returning with a negative PCR test. Will I be able to go directly home and quarantine? Yes, and you will have to place exactly what your status is for when you're returning. If you're a homeowner, because as I had said, tourists go to the safety corridor. Belizeans returning will be able to go home provided that they go to an address. You will also be asked to sign a quarantine form, which means that if health goes and check up on you to see what elements of quarantine you are doing and you are not there and all over the place, I mean, we can have a discussion as to what can potentially happen. Returning property owners who are not Belizeans, you would have to put that in the health app, and you would be considered for going to quarantine wherever your home is. Business people coming back should also have a negative PCR test upon arrival. Is it safe to say that to every confirmed case, 3 other people minimum living in the home would also be considered infected? It depends. We have had big clusters of families. I think the biggest cluster we have heard of is 17 family members being positive in one from that big cluster. In communities such as the ones that are popping up in Cayo, Toledo district, Stann Creek district, is still family-related clusters that are starting to pop up. In the communities up north as well, it's family-related clusters. We do know that some family members are simply saying, well, if one family member is positive, then I don't need to go and get the test done because I more than likely have SARS-CoV-2 as well. Will you be able to identify fake PCR test results from people arriving? That's a very good question. We have had that discussion. We will have quarantine officers reviewing that. As I have said, even if you notice the infographic has not changed, it says even if you bring a PCR test, you may still be sent for further screening at the discretion of the quarantine officer upon arrival. So that would entail that even if you bring a non-fake PCR test, then a real PCR test, you may still be subjected to further screening by the quarantine officers on the ground. As I said, we are trying to expedite the process. We have been reviewing PCR tests of people arriving, so we are more or less noticing what it is that we can expect. Can you kindly state clearly the process returning Belizeans will undergo upon arrival? If they test COVID negative, will they be required to quarantine at a facility for the night until the individual result is confirmed? And if so, what is the charge for night in quarantine? No, as I have said, once your rapid test is negative upon arrival, you will be allowed to go and do your quarantine and elements of quarantine at home. Notwithstanding you bring PCR, you may still be subjected to further screening upon arrival. Of course, the PCR test, as I have said, can expedite the process, but we are not anticipating that people will be staying at any hotel for quarantine purposes. The PCR test, again, if you come with your health app downloaded, all the information uploaded, your walk through the process is going to be much, much quicker. If you do that, then by the time you get swabbed, depending on how many people are, of course, are in front of you. Once you get swabbed, and that's processed through the tube with the buffer solution and all of that, it is going to take on average 20 to 25 minutes for your result to come out with the rapid test. So again, that's assuming you have your health app and you have been walked through that process rather quickly. If you don't have your health app and you have to go and download it and plug in the information, you have to factor in how long that is going to take you. If you do not have access to a mobile device, then it's going to be a manual form, and that will be a delayed process, significantly delayed, because then that information will have to be plugged in by the health staff into the information system. So as I have said, if you can bring a PCR once you come from outside, and once you're bringing your health app downloaded with the information plugged in 72 hours before you arrive, you will make your time and the process rather smooth for yourself. If not, you can anticipate a delay, which can, if you layer minutes, let's say the 20 people in front of you, none of them had a health app downloaded, none of them brought a PCR, then that's the time you have to start to factor in the swabbing process and what is going to happen. We are anticipating that with the full complement of staff at the airport, the lab techs would be able to process between 15 to 20 samples per hour. That's per lab technician, per lab technologist. So if there's 3 to 4, we anticipate it can be 60 to 80. As I said, if you bring your PCR result and you have your health app downloaded, that process can be completed in a much shorter period. So if you do that, then it's going to make everybody's life much, much easier, and your wait time at the airport also much, much easier. Returning homeowners, can they come in with their PCR result, or is it mandatory rapid test at Belize? No, they can bring in the PCR result. As I said, the closer you bring it to the time you board the plane, the better it is for yourself. Notwithstanding that, at the discretion of the quarantine officer, you may be screened with a rapid test result. It's not going to be for everybody. It's a random situation that's going to be done. I have explained why as well. But having a PCR result in hand is certainly going to expedite the process. Do make sure it's a PCR result though, because if it's a rapid test, then you will be subjected to another one here. Or if it's any other test, and I have seen some nucleic acid tests that are not PCR tests, then it's only PCR tests that will expedite the process for you. Whoever doesn't bring that has to go and get and wait in the line for the rapid tests. Can you say how many recovered persons does each district have? Yeah, we can do that. We have been routinely doing it every Monday. I don't think we did last week Monday, but we routinely do that every Monday. That shows a specific infographic that talks about how many active cases we still have. If you notice also, over the last 2 weeks, we have a significant amount of people having recovered as well, but there's still 600 plus persons that are active cases as we move along. Can two persons traveling together use one smartphone app? Yeah, but ideally every person should have one, because it's your personal data. Understand that what we're trying to also use this app for is that this eventually becomes your you see all the paperwork that you have to do, immigration, customs, you have to fill in those forms manually. Eventually, as we move along and improve the app, of course, no longer will you have to do any of those. Everything will be in an app. And it's important that we move towards that, because I know in Central America, there's a call for having one kind of like passport. And I know at least I believe iPhones have something called like a wallet that even keeps your boarding passes and everything with a specific scan code that makes everybody's job easier. You basically don't have to take any paperwork. You just scan everything and you walk through the different processes. So ideally, it should be a health app per person, because that's your individual data that's going in there. Why aren't private medical labs allowed to do COVID rapid test? particularly for those persons who need to travel from Belize. Well, I don't know that people outside of Belize are requesting rapid tests. I think it's PCR tests when they require it. And as I said, we are willing to accommodate that. In terms of why are they not being allowed, I don't think we were not, that's not the terminology we used in early August when we put out the memo. What we were trying to do is find out specifically which populations they are going to be using it for, and ideally that you use rapid tests that have been validated in country. I know there's a particular entity in Belize City that has imported the same SD biosensor that we have validated, and they have said that they are going to use it only for a specific population. So we have to look at the reporting mechanism from them. And I know there's another entity in Belize City that has also said that they want to import that specific test that has been validated. The only question here would be why, on what population you're using it, and what reporting mechanism you have to the health system, public health system. Because if you turn out positive, is it then that private sector will be doing the contact tracing, or what's going to happen? How is that going to be reported into the overall system? I think those are the minor glitches, but I don't think that should be a problem. What we want to be cautious about is, however, doing just importing about any rapid test that you can possibly think of. If a family member was swabbed because of contact with a positive case, the test of family members are to quarantine also. The rest of family members, if you live in one single enclosed space, yes, even if you did not test the entire, let's say I'm the one who tests positive and I live with 4 other persons in a house, even if the others are not having any sign or symptom, we would still recommend that everybody does elements of quarantine. Once the person is, whoever was the index case identified, has turned negative and nobody else has shown any sign and symptom, then everybody will be able to leave the quarantine, the elements of self-quarantine that we are having. But yes, it is recommended that everybody who's living in the same home does the quarantine. The other situation that I think we need to stress here is that the fact that you have been, again, let's say I was exposed last week, Wednesday, and today is Monday, 5 days, 6 days later, I am swabbed today. I get my results Wednesday, Thursday. That's only 7 days after the exposure. Ideally, you have to still monitor yourself, right? Depending on how long after you were exposed you get swabbed. And once, if you develop any sign or symptom, then you need to start over there again. In terms of whoever will require a PCR test for leaving Belize, please make the provisions. You have to send your documentation to the Secretary of the Office of Director of Health Services, and that's the email address is dhsoffice@health.gov.bz. You need to send the information there, your student information, when you are leaving, so that we can tell you when you're going to be swabbed and when you can get your result. For people who are also doing medical reasons for leaving the country, we also would be doing that same thing. I think the only 2 countries that I know are requiring a PCR testing for leaving that we have seen are people who go to Guatemala, and people who are going to Guyana, and I have only known of students going there, and I think we're trying to accommodate everybody. I don't know that any other country is requesting PCR testing for when you leave Belize. I also I think I should stress that you don't need a test if you're leaving Belize. We are not requiring. If you are leaving, you don't need any kind of testing from Belize, right? As I said, these are only 2 countries, and we are trying to accommodate as we move along. Understand that this is aside from all the other work that the health staff does, so it cannot be on the spur of the moment. You need to plan accordingly and make sure that you're informing your family members accordingly. We have had people also who had gotten a swab, and for some reason they couldn't travel to where they were supposed to go. We only come back 3 weeks later and asking for another test because they couldn't travel. I think those things we need to do a better process of going through them. It says, when taking the rapid test at the airport, how long do we have to wait for the results? If you have your health app, if you have all the information uploaded, from the moment you get to the testing booth to when you come out, it should be on average 25 to 30 minutes for your result. As I said, it depends on how many people are in front of you, and you have to factor those things in. And that's why we're recommending everybody downloads that app and plugs in the information in due time, because if not, there's going to be a delay. I can tell you that at the airport this Friday, we had one person, I believe it's 11 people that arrived. Only one person had downloaded the app and plugged in the information. That person went through the process rather quickly, because even when you get to the testing booth, that information is already had by the health folks, and even the processing of your result becomes rather quickly, because all you do is click on your result and that's generated automatically. But if that is not in there, there's going to be a delay, and we anticipate that will be a major cause of delay, and it can be significant if we are not careful. And that's why, as I said, today, tomorrow, Wednesday, we want to walk you through that process so it gets to everybody, and you're not having this process that can be a headache on Thursday. At the end of the day, it's the ministry file that's going to be blamed. But at the end of the day, if you don't do up your part of it, we are only going to be able to do what we are able to do. At the end of the day, you understand that we are doing a test. We cannot be rushed through that process, because we do not want to compromise the quality of any test result we give, versus just trying to do a process to make sure everybody is whisked away from the airport rather quickly. I think there's one, where are we waiting for the results? There's an area close to the new facility that has been constructed as our health clinic. The health clinic has a small waiting area, has a reception area, has 8 swabbing booths, has a lab where the results are processed, and has a clinic/waiting area in case anybody is sick and we're trying to stabilize before they are moved away. So through that process, there's an annex and VIP room, or an old VIP room, that's how it's called. I guess we'll be able to see it on the walkthrough on Wednesday. And there's also another Mennonite house that can be used while people are waiting for results. Again, if you can bring a PCR test, which is the strong recommendation that I'm making I'm making to everybody, as close as you can to when you board the flight, or you download your health app, that process can be rather quickly. I know on Thursday there's one flight coming out of Miami. It's 77 people on average. On Friday, we can anticipate a delay. There's one flight coming in with 77 people approximately as well. And hour 15 minutes approximately is what we are told. We have a flight that is bringing in close to 180 persons. So on Friday, we would anticipate getting more than 250 persons within a space of 1 hour and 15 minutes. Saturday, it's about 220 people within 1 hour and 15 minutes of each other. And by Sunday, that decreases to about 160 persons. So that's Thursday doesn't seem to be that bad. But then if we have 256 people arriving with nobody having downloaded the health app and nobody having a PCR result, you can anticipate delays. There is going to be delays. That's why we're trying to make sure that people are aware of what the mechanism and the process is. And we are trying to expedite everything as quickly as we can. But you need to be able to help us as we move along. Mind you, this is a delay that has gone everywhere you have gone. I mean, we were reviewing what happened in Guatemala when they opened the first 3 days. Even though the PCR is a requirement, from us it's a strong recommendation. In Guatemala, it's a requirement. 10% of those that landed did not have a PCR upon arrival. So then that is a delayed process because they do not allow you to go in until that process has been cleared for everybody. So I think that's what we have for today. Tomorrow, we need to be able to come back and explain the process again. And Wednesday, there should be a walkthrough with the media. That I think after that walkthrough, there might be questions that may come up in terms of that walkthrough. We should be able to address with the relevant entities. I'm being asked about the two deaths over the weekend. It's one male who had been in the ICU at Carlucia in his late 70s. He had been ventilated, but not for an extended period. And we had one death reported at the Northern Regional Hospital in a female who was not transferred to Carlucia. What the EPI team has also been asked to review is to do a comparison between the sudden deaths that we have had this year versus the previous years, to see if there's anything that we have maybe missing, if you're having an increase in myocardial infarction, an increase in people having strokes, and that is important because that would allow us to go and review to see if there's any potential cases out there that we may be missing. So I think that's the information we have. I thank you very much for tuning in. Tomorrow we should be able to provide information, and we should be able to give you a further breakdown of those anticipated cases, at least 37 new cases for today. So thank you very much.